Hi everyone, this is Dr. Crystal Lee of LA Concierge Psychologist. So one of the parents in the group asked me to talk about how would she know if her teen or emerging adult actually needed to go to therapy, actually needed some professional intervention. So generally speaking, you want to think about two different factors. So one is this situation, behavior, whatever, causing actual significant distress in the teen or emerging adult's life? So oftentimes situations or behaviors cause a lot of distress in the parent's life, but not as much with the teen or emerging adult. So if the teen or emerging adult is kind of okay with how things are going, it's not really making them really upset or depressed or anxious, then you might be a little bit out of luck, because then your child isn't actually going to have motivation to go see a therapist because according to them, everything's fine, right? Um, and generally speaking, you probably don't want to force your child to go into therapy unless there's like some major safety issues going on, just because it's going to cause a lot of strain in your relationship with your child. And then in the future, if your child actually needs to go see a therapist, they're actually going to associate therapy with something really negative, because they had this very negative experience of being forced to go see a therapist when they felt like they really didn't need to see a therapist. That being said, sometimes there are some really skilled therapists who can take someone who's mildly motivated or completely unmotivated for therapy and really work with that person and kind of bring them along what we call the stages of change, and make them or help them move from being ambivalent or pre-contemplating about therapy to someone who's more open to the process of therapy. So I'm not going to say if there's no distress, like definitely don't ever send them to therapy, but there are things that you should think about before you kind of move in that direction. So the second thing you want to think about is this behavior, situation, whatever, actually significantly interfering with the teen or emerging adult's life? So there are some things that happen where your teen is going to be really super stressed because of SATs or, applying to colleges, whatever, for a short subscribed amount of time. And in those cases, they probably don't need therapy. But if this is actually something that's going on ongoing for several months and is really distressful and actually interfering with just basic daily life, like they can't go to school, or they've kind of dropped out of doing all the activities that they love, or they are so anxious that they can't actually concentrate in doing their homework or going to their job or things like that, like that's some pretty significantly affecting your teen or emerging adult's life. And in that case, that's also a time where you want to think about maybe your child needs some therapy. And generally speaking, you want a yes to both of those things. So you want your teen or emerging adult to actually have some motivation to go into therapy because they're really distressed, and you want that distress or whatever's going on to actually be significantly impacting their life, because that will also lead to some more motivation to go into therapy. There are some other considerations to think about, like safety, but those are kind of the two big things that you might want to think about when deciding whether or not your child actually needs therapy. So I hope this helped. If you have any questions or follow-up thoughts, leave me a comment and hope to hear from you. Thanks, bye!